Funding provided by the Georgia Trauma Care Network Commission. In this video, we're going to be talking about SALT triage. This is going to be our ability to sort and treat patients during our active shooter scenario, or MCI. We're going to use a couple of tools during this video. We're going to talk about our triage tags, and we're going to talk about our triage tape here that is attached to our North American Response Kit. SALT triage stands for Sort, Assess, Life-Saving Interventions, Treatment, and Transport. So as you, the first responder, make contact with your initial patients, you're going to be doing a few things that's going to help speed the process of a treatment and transporting of your patient. You're going to start sorting, assessing, providing life-saving interventions, and then treating and transporting. The initial responder will triage the patient using the SALT algorithm and then apply the appropriate tape from the North American Response Kit to the patient's wrist or to their leg so it's visible to other first responders. As you, the first responders, approach patients, you will need to begin triaging and treating these patients. And we're going to use the SALT algorithm to help make this process simpler. The first step in the SALT triage algorithm is to do a global sorting. We're going to sort patients into 3 categories: those who can walk, those who can wave, make purposeful movement, and those who are still with obvious life-threatening injuries. Once we have divided this group up, we'll begin to assess the patients that are still or have obvious life-threatening injuries first. The second group of people we will treat are the people who are waving and make purposeful movement. The last group you will assess is the walking wounded. You have the equipment provided to you in the North American Response Kit to provide the life-saving interventions. The life-saving interventions are control major hemorrhage, open the airway. If it's a child, consider 2 rescue breaths. Chest decompression, auto-injector antidotes. The first step in assessing our patient is to assess if the patient is breathing or not. If they are not breathing, they are dead. If the patient is breathing, then we'll move on to the next step of the assessment process. We want to find out if the patient obeys commands or makes purposeful movement, has peripheral pulses, not in respiratory distress. Major hemorrhage is controlled. If the answer to any of those 4 questions is no, you need to consider likelihood to survive with given the current resources. You need to consider the current resources, meaning the amount of rescuers you have on scene versus the patients and transport units. If the patient is not expected to live with the amount of injuries they have and the resources you have on scene, you would need to apply an expectant tag to their wrist or to their ankle so other rescuers can see it. If you believe that the patient can survive given their injuries and the resources you have on scene, then they are immediate red tag. If you are able to answer yes to all 4 questions, then you need to assess if the patient has minor injuries only. If the patient does not have minor injuries only, they are a yellow tag, a delayed tag. If you are able to answer yes to those 4 questions and they have minor injuries, then they are a minimum green tag. Now, once you have provided life-saving interventions and you have sorted and treated your patients according to the SALT triage, you need to begin setting up a casualty collection point. This casualty collection point is still going to be inside your warm zone. Outside of the warm zone, you'll have a cold zone area where you have your triage tarps set up for other rescuers to begin reassessing patients and providing treatment and transport. So at the cold zone triage area or a casualty collection point that has a delayed evac is when we're going to begin using our triage tags. The first responder will once again re-triage the patient, recategorize them, displaying the appropriate color code that matches the SALT algorithm. If time permits prior to transport, the smart tags do allow you to provide patient documentation that will stay with the patient throughout the transport. So between the red tag and the green tag, this section here allows us to write a timeline of the treatment, interventions, and vital signs for our patient. It allows us to document the time, the treatment intervention, who performed it, the patient's blood pressure, pulse, respiratory rate, skin condition, GCS, patient's O2 saturation. Just below the green tag, we're able to document the patient's demographics and sample history. Next to the yellow tag, we're able to document our assessment findings. We're able to draw and write on this card your findings. On the other side of the yellow tag, we're able to calculate the patient's GCS and trend those scores throughout our time with the patient. So at the bottom of the tag, we do have the ability to tear this section off. This is going to provide us information such as where the patient was transported, their condition, and their priority. Another thing you need to consider during the treatment and transport portion of SALT triage is the transport destinations. You do not need to overwhelm one hospital during an MCI. You need to notify multiple hospitals early that you have an MCI and get them prepared to accept multiple patients. This may include accepting patients that they would not normally accept, such as pediatrics.